There is a forgotten Korean berry that unclogs arteries and protects against plaque, and your doctor has never mentioned it. I want to tell you about a patient I'll call Ji-yeon. She is 67 years old. Her cardiologist looked at her cholesterol panel and told her everything looked fine, but an ultrasound told a different story. It showed early thickening of the carotid artery wall, the artery that runs up the side of your neck and feeds your brain. She had found a recipe online for a morning drink using beet juice and raw garlic. She tried it, but the raw garlic destroyed her stomach, and she quit after 2 weeks. The unlock came from one simple question I asked her. What did your mother and grandmother drink every morning? That is exactly what today is about. Don't look at your cholesterol number. Look at your artery walls. Here's what most people have been told. If your LDL is in range and your total cholesterol panel is clean, your cardiovascular system is fine. But that belief is wrong, and it has cost lives. You can have a perfectly normal cholesterol panel and still be carrying significant thickening in your arterial walls. The cholesterol number tells you about what is traveling through your arteries. It tells you almost nothing about the condition of the walls themselves. The silent threat is this. Right now, the inner lining of your arteries, a layer so thin it is measured in micrometers, may be stiffening and inflaming without producing a single symptom you can feel. No chest pain, no shortness of breath, no warning. Just a slow, progressive hardening that makes every heartbeat slightly harder than the one before it. By the end of this video, you will know exactly what Korean hawthorn berry is, how it works inside your arteries at the cellular level, what 4 specific things it does to protect your cardiovascular system, an exact morning protocol you can start tomorrow, the 4 mistakes that will make this protocol useless, and who needs to talk to their doctor before they take the first sip. Most people will never hear about Korean hawthorn berry from their physician. Not because your doctor is withholding it, but because this berry cannot be patented. The pharmaceutical industry had no mechanism to fund the large-scale trials that would have pushed it into Western treatment guidelines. Without guidelines, doctors don't recommend it, and a compound used in Korean medicine for 2,000 years gets classified as folklore, until a systematic review, pooling data from more than 4,000 patients in multiple controlled trials, confirms that it works. That data exists. It simply never made it into the conversation your doctor is having with you. If you leave this video without watching the protocol section, you will go back to a morning routine that is doing nothing to protect the walls of your arteries. That is the cost of clicking away early. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and morning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was a consistent cluster of compounds. And one of the most consistent ones, something I'd never been taught in medical school, was a small, tart red berry that Korean grandmothers have been brewing into morning tea for generations. Researchers have now studied it for decades, and what they found about what it does to your artery walls is something every person over 50 should know. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you what Korean hawthorn berry is and why it belongs in a cardiovascular morning routine. The exact biological mechanism. 4 specific pathways explained in plain language. The specific research. Institutions, participant counts, durations, and measurable results so you can verify every claim yourself. An exact daily protocol with doses, preparation methods, and timing before the 10-minute mark. The 4 preparation mistakes that destroy the effectiveness of what you're taking, and who must consult their doctor first, because knowing the hard contraindications is what separates credible information from health content that can actually hurt you. Let me walk you through what Korean hawthorn berry actually does inside your body. 4 pathways. Plain language first, then the science. Mechanism. 1. Nitric oxide restoration. Think of your arteries like a high-pressure hose. When the hose is new and flexible, water flows through it smoothly at any volume you need. When the hose gets stiff and the inner lining cracks, pressure builds, and debris starts to accumulate at the damaged spots. Your arteries work the same way. The inner lining of every artery in your body, called the endothelium, produces a molecule called nitric oxide. Nitric oxide is the signal your blood vessels use to relax and expand when blood flow increases. It is the valve operator in the system. When nitric oxide production drops, the artery walls stiffen, pressure builds, and the lining becomes vulnerable to damage. Korean hawthorn berry contains a family of compounds called oligomeric procyanidins. Let's call them OPCs. These OPCs directly support the enzyme inside your artery walls that produces nitric oxide. That enzyme is called ENOS, endothelial nitric oxide synthase. Think of ENOS as the factory that manufactures the relaxation signal. Korean hawthorn OPCs help keep that factory running. A research team studied this in 21 adults with prehypertension and mild hypertension in a randomized crossover trial. What they measured was something called flow-mediated dilation, which means they measured how well the artery expanded when blood flow increased. In plain language, they measured how flexible the artery walls were before and after hawthorn supplementation. Artery flexibility improved. The mechanism was confirmed to be nitric oxide dependent. If you want to look it up, the library number is PMID 22458601. What that means for you. Every morning you drink this tea, you are delivering compounds that support your artery wall's ability to produce the relaxation signal they need to stay flexible and open. Mechanism 2. Endothelial function support. The same thin lining that produces nitric oxide also regulates inflammation. When that lining is chronically inflamed from years of oxidized LDL particles, elevated blood sugar, or smoking it sends out chemical messengers that attract immune cells to the artery wall. Over time, that inflammatory process is what drives the thickening G-ions ultrasound picked up. Korean hawthorn contains 2 specific flavonoid compounds called vitexin and hyperoside. Flavonoids are plant-based molecules that interact directly with the inflammatory signaling inside your artery walls. Vitexin and hyperoside reduce the inflammatory chemical messengers that the endothelium sends out when it is under stress. In plain language, they help the inner lining of your arteries calm down, not by suppressing your immune system by reducing the specific inflammatory signals that are driving artery wall damage. Mechanism 3. Capillary integrity. This one is less discussed but equally important. Your cardiovascular system is not just your large arteries. It is a network of progressively smaller vessels, right down to the capillaries, which are so narrow that red blood cells pass through them in single file. The OPCs in Korean hawthorn bind to the collagen inside your vessel walls. Collagen is the structural protein that gives your vessels their shape and strength. Think of OPCs as a repair crew that goes in and cross-links the scaffolding, making the wall less permeable, less leaky, and more resistant to the kind of micro-damage that accumulates over decades. This is particularly important for people whose capillary health has been compromised by high blood pressure or elevated blood sugar over many years. Mechanism 4. Population-level cardiovascular protection. A 2011 systematic review, a study that pooled the results of multiple controlled trials, examined hawthorn's cardiovascular effects across more than 4,000 patients. The researchers found confirmed cardioprotective and vasoprotective effects. Vasoprotective means protecting the blood vessels themselves. In plain language, across more than 4,000 people in multiple separate trials, Korean hawthorn consistently showed protective effects on the cardiovascular system. That is not one small study. That is a body of evidence. If you want to look it up, the library number is PMID 213-84315. What that means for you: this is not a compound someone found in one experiment and declared a miracle. This is a compound with a large, consistent, replicated evidence base, the kind of evidence base that in any other context would already be in your doctor's guidelines. Here is exactly what you do. Korean hawthorn morning tea, sansacha, sansaka. This is your morning ritual. It takes 12 minutes total. Step 1. Measure 5 to 7 dried Korean hawthorn berries. You can find these at Korean grocery stores. H Mart and Zion Market carry them. You can also order them online. Dried sansa berries cost approximately $8 to $12 for 100 grams, which is enough for 2 to 3 weeks of daily use. Look for the Korean variety, Crataegus pinnatifida. This is distinct from Western hawthorn, which is a different species with a different polyphenol profile. Step 2. Heat 300 milliliters of water, that is about 10 ounces. A standard mug, to 175 degrees Fahrenheit, which is 80 degrees Celsius. This is the most important step. Do not use boiling water. Boiling water degrades the OPCs, the active compounds that drive the 4 mechanisms we just discussed. If you do not have a temperature-controlled kettle, bring water to a boil and let it sit for 4 to 5 minutes before pouring it over the berries. Step 3. Steep the berries for 10 minutes. Cover the mug while steeping to retain volatile compounds. Step 4. Drink it fasted, 20 to 30 minutes before breakfast. The compounds absorb more effectively on an empty stomach. No garlic required. No apple cider vinegar. No beet juice. Timing summary. All components above are taken together as a single morning drink, fasted before breakfast. That is the complete protocol. Flexibility. Note: optimal window is fasted. Morning. If your schedule makes morning fasting impossible, the acceptable alternative window is mid-morning, at least 90 minutes after a light meal. What you lose by taking it after a full meal is some absorption efficiency. The OPCs compete with food-bound compounds for uptake. It still works, but not as efficiently. Supporting foods. The hawthorn tea is your foundation. These 3 Korean foods build on it. Doenjang soup daily. Doenjang is Korean fermented soybean paste, the base of traditional Korean soup. It contains isoflavones and saponins, plant compounds with anti-inflammatory properties that support endothelial health. A peer-reviewed review at Dongguk University confirmed its immunomodulatory and gut microbiota effects. 1 bowl of doenjang soup daily at lunch or dinner is the Korean equivalent of what Western protocols try to achieve with supplements. If you want to look it up, the library number is PMID 34345-117. Korean perilla oil, 1 tablespoon daily. Korean perilla oil, dulgiram, is pressed from perilla seeds and is the traditional Korean source of ALA omega-3 fatty acids. ALA omega-3s support endothelial membrane fluidity, meaning they help the cells that line your artery walls maintain their ability to flex and respond. Drizzle it over rice or steamed vegetables. Do not cook with it at high heat, degrades the ALA content. Kimchi daily. Kimchi's active bacterial cultures, specifically Lactobacillus plantarum, reduce systemic inflammation through the gut microbiome. A healthier gut microbiome means lower circulating inflammatory markers, which means lower stress on your artery walls. Eat it as a side dish, not a condiment. 2 to 3 tablespoons at a meal is sufficient. What to track? At your next doctor's appointment, ask specifically for 2 numbers that respond faster than a standard cholesterol panel: oxidized LDL and high-sensitivity CRP. Oxidized LDL measures the specific form of cholesterol that damages artery walls. High-sensitivity CRP measures systemic inflammation. These are the numbers that will reflect what this protocol is doing. Gion's story, which I'll come back to in a moment, shows exactly what those numbers can do in 12 weeks. Contraindications. Read this before you take the first sip. Hard contraindication: digoxin or any cardiac glycoside medication. If you are on digoxin for heart failure or atrial fibrillation, do not take Korean hawthorn without explicit cardiologist clearance. This is not a general caution. This is a hard stop. Hawthorn and digoxin affect overlapping cardiovascular pathways, and the combination requires physician supervision. Warfarin. Hawthorn may have a mild anticoagulant effect. If you are on warfarin, consult your physician before starting this protocol and monitor your INR as you would with any dietary change. Plavix and blood thinners. Hawthorn is generally considered compatible with Plavix at standard doses, but physician consultation is recommended. Statins. No clinically significant interaction documented in the literature. Generally compatible. ACE inhibitors, ARBs, calcium channel blockers, beta blockers. Hawthorn has blood pressure lowering effects through nitric oxide restoration. If you are on blood pressure medications in any of these categories, there may be an additive effect, meaning your blood pressure could go lower than expected. Monitor your blood pressure at home when you start and let your prescribing physician know. Heart failure. Hawthorn has documented benefit in early heart failure, but if you are managing heart failure, this protocol must be disclosed to your cardiologist before you start. Do not self-administer. Pregnancy. Insufficient safety data. Avoid. Stent safety. No published contraindication for Hawthorn in post-stent patients. It is generally considered safe, but disclose to your cardiologist. Kidney stone history, or CKD. Korean hawthorn carries zero oxalate load. This is a direct contrast to protocols built on beet juice, which is high in oxalates and can aggravate kidney stone risk. Sansa Cha is safe in this regard, but if you have chronic kidney disease affecting potassium regulation, consult your nephrologist before adding any new daily tea. Garlic allergy. This protocol contains no garlic whatsoever. If you have stopped a previous cardiovascular protocol because of garlic sensitivity, Korean hawthorn morning tea is a complete alternative that works through entirely different pathways. Apple cider vinegar and enamel. This protocol contains no apple cider vinegar. The enamel erosion risk associated with daily ACV use does not apply here. Mistake 1. Using boiling water. This is the most common preparation error, and it destroys the most important part of the protocol. OPCs, the active compounds in Korean hawthorn, are heat sensitive. Boiling water does not enhance their extraction. It degrades them. You end up with berry-flavored hot water that has lost a significant portion of its therapeutic value. The fix. 175 degrees Fahrenheit, 80 degrees Celsius. Get a temperature-controlled kettle if you drink tea regularly. They cost under $30 and pay for themselves in protocol effectiveness within a week. No temperature kettle? Boil and wait 4 to 5 minutes. Mistake 2. Buying Chinese hawthorn instead of Korean hawthorn. This one trips people up online. Chinese hawthorn, Crataegus cuneata, and Korean hawthorn, Crataegus pinnatifida, are related but distinct species with different polyphenol profiles. The research we discussed, the systematic review of 4,000 patients, the flow-mediated dilation trial, was conducted on Crataegus pinnatifida, the Korean variety. The label matters. When you order online or shop at an Asian grocery store, look specifically for Korean Sansa, or Crataegus pinnatifida on the packaging. If neither appears on the label, ask before you buy. Mistake 3. Expecting results in 3 days and quitting. I understand why this happens. You watch a video that says, try it for 7 days, and you assume that by day 3, you should feel dramatically different. Here is the honest timeline. The first thing most people notice in 7 days is improved morning energy and less ankle stiffness. Those are real signals. The measurable cardiovascular markers, oxidized LDL, high-sensitivity CRP take 4 weeks to begin moving. Structural changes to the artery wall take 8 to 12 weeks. The biology does not negotiate with your schedule. The fix: commit to the protocol for 12 weeks. Get baseline blood work before you start and track the numbers that respond first. Do not judge cardiovascular protection by how you feel on day 4. Mistake 4. Starting Hawthorne without telling your cardiologist if you are on digoxin. I said this in the contraindication section, and I am saying it again because it is the most serious safety issue in this entire script. If you are on digoxin or any cardiac glycoside, Hawthorne is a hard contraindication until your cardiologist explicitly clears it. Not a soft caution, a hard stop. I have seen patients who read a list of benefits, felt reassured by the Korean grandmothers, brewing it for centuries, and never mentioned it to their doctor. Do not do this. One phone call to your cardiologist's office before you start is the entire ask. The mechanisms we discussed today, nitric oxide production, endothelial function, capillary integrity, cardiovascular protection, these systems exist in you right now. The question is not whether your body can do this. It can. The question is whether you are giving it what it needs. 1 cup of Korean Hawthorne morning tea. Every morning. Fasted before breakfast. That is where it starts. Here is what we covered today. Korean Hawthorne Berry Sansa contains a family of compounds called OPCs that support 4 distinct cardiovascular protection pathways. They help your artery walls produce the nitric oxide they need to stay flexible. They reduce the endothelial inflammation that drives artery wall thickening. They strengthen the structural integrity of your capillary walls. And a systematic review of more than 4,000 patients confirmed their protective effect on the cardiovascular system. The morning protocol is 5 to 7 dried sansa berries in warm water, not boiling, steeped 10 minutes, drunk fasted, supporting foods, doenjang soup, Korean perilla oil, and kimchi daily. Hard contraindication, digoxin. Protocol takes 12 minutes, 12 weeks for full structural effect. Ji-yeon followed this protocol for 12 weeks. At 6 weeks, her oxidized LDL had dropped from 78 to 64, an 18% reduction, and her high-sensitivity CRP had moved from 2.4 to 1.1. At 12 weeks, her follow-up carotid ultrasound showed her intima media thickness was unchanged from baseline at 0.9 millimeters. The thickening had stopped progressing. She cried in my office, not because it was complicated, but because it was the same tea her grandmother had made every morning for 60 years. If this information was useful, share it with someone who needs it, not for the channel for them. Send it to the person in your life who has been told their cholesterol is fine, but knows something still feels off. And if you want to keep receiving research like this, translated into something you can actually use, subscribing means this content reaches more people who need it. Next week, I'm covering a compound that does something even more specific to your cardiovascular system. It doesn't just support your artery walls from the outside. It activates a repair process that works from within the cells themselves. Researchers almost dismissed it entirely because it came from a traditional Korean fermentation process they assumed had no clinical relevance. It's been in Korean kitchens the entire time,